Hi, I'm Dr. Carl Mangum with the University of Mississippi School of Nursing. I'm going to talk about anaphylactic shock, in particular its pathophysiology. Anaphylactic shock is a type 1 hypersensitivity response that begins when a sensitized individual is exposed to an antigen, whatever the antigen may be. A widespread reaction through the body occurs when between the antigen and the IgE antibodies on the surface of the mast cells, and to some extent the basophils also. Large amounts of vasoactive substances are released, causing systemic vasodilatation and increased capillary permeability. Now let's go in further into this and see how it really acts. This is an example of a mast cell. You see the antigen and the IgE antibody there reacting. Now let's talk about some of the mediators that are released during this time. The first one we're going to talk about is histamine. Now, histamine is a potent vasodilator, resulting in significant reductions in blood pressure when released in excessive amounts. It also causes bronchial constriction and mucus production. So it causes several things. The next one we'll briefly talk about is leukotriene. Now, leukotriene causes smooth muscle constriction, bronchospasm, and contributes to increased vascular permeability. The next one is bradykinin. And in bradykinin, it contributes to the vasodilatation also. Are you starting to see a theme of what we're talking about here with the vasodilatation? And the last one we'll talk about is the prostaglandin E2. Now, prostaglandin E2 also contributes to that vasodilatation and increased permeability. Now, what does all this do to the person? Well, let's take a general person here. We'll call him Stick Man. And what happens to him during this? Well, many things. Vasoconstriction for one, which they'll complain about difficulty breathing. They may say, my throat's closing up on them. They have laryngeal spasms, difficulty speaking. There's also, that also affects the lungs when that happens. So they're not able to move air and get oxygen in and out, in and throughout the body. Also, there's gastrointestinal issues that may happen, and that may be nausea, vomiting, diarrhea, cramping, things like that. There could also be swelling and edema throughout the whole body. It takes a toll. Now, when we talk about the vasodilatation itself, we're really talking about the increase in the size of the intravascular compartment. And it's really producing a relative hypovolemia. Now, unlike with hemorrhagic shock, there is no blood loss. All it is that the area has a bigger container for the same amount of fluid. When we think of that, we think if we take this 8-ounce cup of coffee and we pour it into this 16-ounce cup, what do we have? Well, you still have 8 ounces of coffee, it's just now in a bigger cup. And that's what happens within the body. Now, at the same time, in the periphery, blood begins to pool due to venous dilatation and is no longer available for vascular circulation. So we think about what's going into our heart, and we call that preload. Now, the amount available to come back to the heart now is decreased. So we have a decreased preload. Now, with decreased preload, what does that lead to? Well, it leads to decreased cardiac output. Because you don't have as much coming in, so you can't put as much out. When that happens, what does that do to the rest of the body? Well, that causes a decrease in O2, or oxygen, to all the tissues of the body, which is not good. Now, we're talking about that fluid starting to pool in the periphery. The increased capillary permeability permits fluid in the blood vessels to shift in the interstitium, contributing to that edema. Now, we think about the gap junctions here in the cell. And when they're tight, it can't get out. But when the gap junctions are open, that permeability is there and able to come out, which causes the edema and the relative hypovolemia that we're facing. Now, with the combination of the vasodilatation and the increased permeability in the anaphylactic shock, without some type of intervention, something bad is going to happen to the person. It'll result in impaired cellular metabolism to start with. So if you have your cell and all the parts that are in it, okay, and what does it need? It needs ATP to perform those cellular functions. Now, an adequate amount of oxygen is present. A total of 30 ATP molecules can be produced per glucose molecule. But when there's not enough oxygen, as with this reaction, you can only produce 2 ATP per glucose molecule. Now, I don't know about you, but I think I need all 30 of my ATP working. Now, depending on the amount of exposure to the antigen, whatever that is, and we'll use the bee sting there, and the rate of metabolic activity of the person, and how quickly an intervention is administered, how quickly they can get help, cellular death will start to happen without that lack of oxygen. So if we have our person here, cellular death starts to occur. When cells start to die, then systems start to fail. And when you have system failure, you end up having a complete failure. And that complete failure will eventually lead to death. If it's not administered, something's not administered to the person. Now, in review, we're talking about an allergic reaction based on the amount of antigen that they're exposed to that causes the vasodilatation and the capillary permeability, which decreases the O2, which causes the cell death, which causes the system failure, which can lead to death of the host. Thank you.